Do you know what to look out for with Obamacare in 2015? Well, stick around because that's what we're going to take a look at today. How's it going, everyone? I'm Joey Gingola with Gingola Insurance, and today we're going to really just kind of get an overview of what's going on, who's involved, and what you kind of just need to know at a very basic level with Obamacare, healthcare reform, the Affordable Care Act, ACA, whatever you want to call it. It's all the same thing, and we're in year 2, full swing, open enrollment season is underway, and you need to know who to consider, who's out there, what's available, what's a legitimate insurance company. I have clients ask me all the time. I've heard somebody tried to talk to me about this company. I've never heard of them before. Are they a real company? And for the most part, they are, yes. And most of the fly-by-night health insurance companies have kind of gone away. The community mutual health services of financial benefits companies have ceased to exist. Those are the ultimately completely fake-sounding names that you should be wary of, and they have, for the most part, due to the law changes, really don't all that exist anymore. They're kind of not around, or at least they can't do what they did before. Now they might be offering something a little bit different, but here's the list of companies that you need to look out for or be aware of in 2015 if you're buying health insurance in Ohio. So I'm going to pull up a list right here on your screen, and the companies that are participating in Ohio's health insurance marketplace this year are Aetna, Anthem Blue Cross Blue Shield, Assurant, CareSource, HealthSpan Integrated Care, InHealth Mutual, Medical Mutual, SummaCare, and United Healthcare. So you might be saying to yourself, well, that's great. I've only heard of maybe a few of those companies on that list. And for the most part, all of them are legitimate. They are real health insurance companies that you will probably want to buy health insurance from. From that list, Aetna, Assurant, InHealth, and United Care are all brand new to the marketplace this year. So they sat the first year out. They said, no thanks. We're gonna take this one off, and we'll maybe hop in next year if things go reasonably well for everybody. But there's no way we're getting in the mix in 2014, and they didn't. So you were unable to buy a subsidized health insurance plan from those companies last year. So important note, this is InHealth Mutual's first year offering health insurance in Ohio. They are a co-op who received startup and solvency funds from the federal government. Being an insurance company, you have to have so much money on hand in reserve to kind of validate your financial solvency, is the fancy insurance word, or basically, can you pay what you might have to pay if you need to pay it, is really kind of the easiest way to explain that. And for an insurance company starting off cold, really hard to have that type of money on hand, at least in year 1. So they went to the federal government to get started this year. And they claim it is what will allow them to be in it for the long haul. And that's a direct quote from their website. So you can do with that information what you will. Back to Aetna, Assurant, and United Healthcare. They've all been around a long time. They're all, for the most part, legitimate insurance companies. I'm sure you've heard of at least Aetna. They're probably, I think, the 3rd largest company in the world, or insurance company, that is. And I mean, name recognition goes a long way. Is that mean that they're going to offer something that's going to work for you? Well, not always. But I can tell you that I've dealt with all of those companies as long as I've been in the business. HealthSpan's an interesting case, as they were formerly known as Kaiser Permanente. Now, Kaiser Permanente you probably are familiar with, being the most famous HMO structure health insurance company probably out there. They were started out in California. And basically, HMO means you can only receive treatment from their specific facilities. If you have facilities and doctors in that kind of network that you like, if there's within that group, if they have services to cover you, then most people have a really decent experience with it. Other times, if not, well, you might not be so happy. And usually also, for an exchange for such limited services, you can obviously expect to pay a lot less for that. However, in my first initial kind of runnings of rates and kind of checking into things, I don't really see that happening, which is strange. So while they still operate that way, in most cases, the rates are not going to be favorable enough for you to consider making that sacrifice in doctors and hospitals. One thing I did find interesting about HealthSpan is that since they just went over like a huge rebranding, changing the name of the company, I really couldn't find it anywhere on their main website pages, in their About Us and their history. I had to go digging in their news section to find a press release from back last year when they announced the name change, and that's really the only mention that they made of it. It's kind of weird. And then that leaves us with Medical Mutual and Anthem Blue Cross Blue Shield, the pre-Obamacare top dogs, if you will. And they've been running neck and neck over the last couple years for the top spot in Ohio. And while they still both, for the most part, remain relatively solid choices, I mean, mostly, Medical Mutual really pulled itself away from the pack last year, but you can go ahead and read. I actually went ahead and broke down these companies head to head in 2015. You can go ahead, there's a nice little annotation to click there. If you want to click through to read and watch that full comparison that I made between those top two companies. Now there's CareSource, which up until 2014, last year, they were exclusively a Medicaid provider. So basically, if you qualified for Medicaid, meaning you had low income, they were assigned to you from the state of Ohio. This is their first few attempts to actually provide you health insurance that isn't been kind of dictated to you. I don't believe they worked with agents last year. I don't know if they were considering working with agents this year, so I can only speak very limitedly about my experience with the company, as they don't allow us in most cases to handle their business. Now, SummaCare is a little bit different from everybody else on this list. They were, initially started out as a hospital provider. They were actually just a hospital. So Summa is a bunch of facilities that are primarily dominant in Summit County in the Northeast Ohio area. And it claims to be, I'm going to read this quote, one of the region's only provider-owned health insurance companies. And again, which has been around since the early 90s. So what's the bottom line? Well, this is just kind of a really basic overview of, like I said, just kind of a few bullet points to summarize exactly who and what these companies are. And just to kind of help you understand at a very 30,000 foot view what you're dealing with, who's out there, and what you can expect with your health insurance. Of course, it is important to remember that you do have until December 15th, only a couple weeks from now, to purchase or make any changes to your existing plans for them to take effect at the first of the year. Otherwise, you're going to have to wait and have them start after that, depending upon when you actually get it in, sometime in February, March, or whenever it is. So, important deadline coming up that you're not going to want to miss. So, of course, we do have more information if you want to go deeper on this to understand the exact working parts of getting health insurance in Ohio here after this whole Obamacare thing. And you can go ahead and click right here. There's a nice little big picture here with my face on it, a video series to help you understand how to get health insurance in Ohio this year. And it's just going to be 5 parts. It's going to walk you through every step that you need to know and understand how to qualify, if you qualify, what you need to do, what you don't need to do, and how to get it done. Of course, if you do want to get started, since we are working on a very short deadline here, well, I'm just going to invite you to reach out to me directly. Feel free to give me a call. That phone right there, it's going to ring right to me. Or you can email me, joey@jingolainsurance.com. I'd be happy to talk with you and answer any questions that you might have. Just reach out and let me know what's going on with your situation. Or if you actually just want to go one step further, you can go to jingolainsurance.com/schedule and just book a 30-minute phone call with me. And we'll just talk, we'll see what's going on, and we'll really get to the bottom of it and help you make that decision fast and get it done on time for this deadline and make sure that you're taken care of for 2015. So but that's it. Of course, I do always appreciate you taking time to watch this video. I do greatly appreciate it. And as always, I am Joey Jingola with Jingola Insurance. Take it easy, everyone. So they're a co-op that was started and received. So they are a co-op that was. So they are a co-op who received startup